topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Dallas-Fort Worth. Welcome to another Ask the Expert show, where for the last 16 years we have brought you the finest experts in the field of legal, health, financial, and home improvement. Hey, today is the last Wednesday of the month, and that means Dr. Gamboa. I got to tell you, good afternoon, Dr. Gamboa. I was just telling you, before we went on the air, we get so many emails, people who love your show, who have said they have learned so much. In fact, one lady said she's moving to the Dallas-Fort Worth area next month, and she is going to make you her physician.
Awesome. Thank you.
Yeah, I thought that was so cool. And,
yes.
You just have a way of explaining. It's almost like, I've never heard a doctor explain the way you do. And we're just so lucky to have you. The name of your clinic is Elite Care Clinic. And we will be giving out your phone number and your website. But hey, tell people about your practice.
Sure, Steve. Yes, my practice is, as you said, Elite Care Clinic here in Irving, Las Colinas. And I do mostly family medicine, primary care. But also what I am doing more, it's preventative care, I do preventive. I do also weight loss. We do hormone replacement therapy, and also I do aesthetics and procedures because feel good, look good, and now a lot of people are wanting to look more natural while we're aging. We want to age gracefully, and we don't want to do more invasive treatments. We don't want to look plastic, so to speak. We want to look great, but at the same time, natural, and less invasive and less downtime procedures.
I think I mentioned this on our last show, but because we are getting so many new listeners, people telling their friends about your show and all the promotion we do. I've told you before, I've shared with you that I have major kidney problems. In fact, stage 4 kidney failure, which is about the worst you can get. And last month, I went into my nephrologist. I've been on the Ozempic injection for a little over a year. And my doctor was amazed. He said, normally when you have kidney failure, it never gets better. We just got to keep it from getting worse. He said, your blood work is amazing. He said, you're no longer stage 4 anymore. You're stage 3. And
that's
it's
awesome.
Gotta be from the Ozempic. I got to think so.
Well, I think it's a big thing on that, and if the Ozempic also has an FDA indication for CKD, that's chronic kidney disease. So I think it's a combination. Probably you're in other medications as well, but that had a lot to do. Probably you lost weight as well, and that also is decreasing the load on your kidneys. So it's helping, and if we are also lowering your blood sugar, then it's also decreasing the load of sugar that your kidneys have to deal with, and it's decreasing the damage that the sugar does to your kidneys. So that's awesome, Steve. I'm so happy for you.
Well,
congratulations.
I am too. I got it. We just got our text in, which kind of goes along with the injection,
Mhm.
And she said, you keep mentioning that many patients are doing well. She said, I still am not losing weight from, she's on Wachovia, I think it is. Yeah.
Wegovy, Wegovy. Mhm.
Yes. She said, why does that happen that it works for so many people and not for myself?
Sorry to hear that, but also we have to look at different things. Like weight is complex. You also have to think how old are you? We have to see like if you need also to add some hormone replacement to your regimen. We have to see like how's your insulin resistance. We have to see many factors, but also we have to look and see what's your dose, because not everyone is going to respond to the same dose. I have patients that they do great on 0.25. That's the baby dose, the starting point, and they feel nauseous and they have all the symptoms. And there are other people that they don't feel anything with 0.25, and we have to keep going up, titrating up the dose. And whenever they are in the next to the last one, like 1.7, they start feeling the symptoms, and finally they're like starting to lose weight whenever they're in the highest dose. Also, we have to see attack the weight from different angles. We have to also like probably like add some medications to your regimen, but I have seen some patients that they don't respond as great to those medications, and we are starting to think, is it like with anything that excuse me, that you have maybe like more resistance to these medications? Do you have more receptors that we need higher doses for your receptors to start like being like more active? So we don't really know the exact reason, but again, we have to attack it from different things. So we have to look into how's your thyroid function, how are your hormones, so many other things that we have to look, and not just wait for the Wegovy to do its job. And also we have to see like what else are we doing? Are we doing some resistant exercises? Are we increasing your protein intake? So many other factors that play in.
That makes sense. This is from Millie in Irving. My mother turned me on to your show, and now I can't stop watching it.
Thank you, Millie.
She said, have you ever heard of underlying metabolical dysfunction?
Well, yeah. So the metabolic dysfunction is what we all have, like whenever there's like insulin resistance. Whenever we have metabolic syndrome, that's whenever your triglycerides, one portion of your cholesterol is high, your waist circumference is greater than 35 in women. So whenever we have a lot of like visceral fat, we start having all this metabolic dysfunction, and people with polycystic ovarian syndrome, like PCOS, they have metabolic dysfunction. They have a lot of insulin resistance. So yes, all of that goes along with metabolic dysfunction. That just means that you have insulin resistance. You're not able to like process this properly. You're not able to burn the calories as you were supposed to. So it's a constellation of symptoms.
Kelly in Plano, thank you for your show. I'm so glad you do a show like this. I'm wondering, there are so many diets out there. I'm talking about food plans. How do you know which one to listen to? There's so many out there.
Yeah, like unfortunately, like that's so many. And if you do like the keto, if you do this, but the only diet I would say that has like evidence that can decrease your cardiovascular disease is like the Mediterranean diet, and why? It's because like it has less processed foods, it has more like vegetables, more fruits, but also like has a lot of omega-3/6 fatty foods in there. So the omega-3s are in the olive oil, in the avocados, in the almonds, the salmon, the flaxseed. So all that can help you with decreasing your cholesterol, and also like helps you decreasing your cardiovascular disease. So in terms of like plans, I would say like we have to like also help you with finding how active are you, like are we, like to have an idea of what your metabolic rate is, like so how many calories are you like burning, give or take. That's one little portion of the equation. But based on that, also we can come up, well, okay, let's increase your protein. How much do you weigh? What's your BMI? What's your like height? To see and calculate how many grams of protein you will need, you will require. So with all those like numbers, and we can say, okay, you need like a higher protein, or are you like training for a marathon, then we need higher protein for you, or you're an athlete, so we need like higher. Also, if you are in the skinny injections, as like Steve mentions them, the GLP-1s, you need extra like protein because you tend to lose muscle mass faster than with regular weight loss, so we have to make sure that we do resistant exercises, increase your protein intake, but there's no like specific one diet. Oh yeah, this one, it has to be customized. It has to be what is also your lifestyle. What are the things you like? Like I don't really like too much of those diets of in the morning, every Monday, you're going to eat half of like an egg. You're going to do this. I mean, no, we cannot do that. So we have to meet the patient where they are. So see what is your like lifestyle and see what's your work schedule. So with all those things, we can come up with a plan that will be able to work, because what's the point of like giving you like a specific like diet and all that if you're not going to be able to follow, or if it's going to be too cumbersome for you to like do something about it, so that's why we have to do a customized plan for you.
This is from Frida. She is in Mesquite, Texas. She said, a friend of mine turned me on to your show. I'm so glad.
Thank you.
What
Frida.
role does hormones and insulin play in weight loss? And why do you test for things like leptin and insulin resistance in programs you offer?
So like, great question. And thank you so much for bringing up the hormones, because that's the great announcement that I wanted to make. First, I'm going to answer your question, and then I will tell you about the announcement. So why like the hormones are important, because we are seeing that whenever women are in perimenopause or menopause, then the lack of estrogen is making your insulin resistance go up. So as this goes, then again, like we gain weight in the abdomen, we do visceral fat, increases more your insulin resistance. So that's why whenever you're in that change of life, started in perimenopause, we start gaining weight, and it's more in the abdomen area. And that's why you need a combination of hormones and weight loss or GLP-1 injections to help us with insulin resistance. So in terms of like, why do I check the insulin resistance, or what do I check? Yes, I like to check insulin resistance because also I can help you with supplements like chromium, like for the insulin resistance. We can do some berberine. We can do like some supplements to start you with. But if your insulin resistance is higher, then I can start you in medications such as metformin. Metformin is more for, we always hear for diabetics, but we use it for so many things: insulin resistance, polycystic ovarian syndrome, weight loss. So we use that to help us with that issue, but first we have to modify your diet, supplements. We have to have a good gut bacteria, your probiotics, that's so important also for all of this. And with all that, the other one, the leptin, like we don't check it that often, almost like we don't. So we basically just help you with the insulin resistance, and then also see how like we can improve your metabolic rate. We optimize your thyroid. What else we need to do? Hope I answered your question. But now with the announcement, I don't know I don't know if everyone has like heard about this FDA removal of the black box warning about the estrogen, because like, remember, like every kind of estrogen was having a black box warning saying that it was like increasing your risk for cancer, increasing your risk for cardiovascular disease, increasing your risk for like blood clots, in spite of all this evidence that was telling us the contrary. So thank the Lord that finally, after like almost 2 decades of having that black box warning, it's been lifted. And it's great, because this is going to open the doors for so many women that they were with a lot of fear of starting like hormones, but please don't have the fear. Like, the hormones help you, like they are going to decrease your risk for cardiovascular disease. They're going to help you with like decrease your risk for dementia. They're going to help you with so many things that I'm really happy that finally they are doing this. So it's moving towards the right direction. So that's really
cool. Oh my God, that is great.
That was the great announcement. Yes. I told you. Yeah.
Here's Here's from Margaret in Little Elm. Why do so many people lose muscle instead of fat on
Oh,
weight
wow.
loss drugs? And how do you prevent that?
So great question. So like the problem is that with the GLP-1 injections, we tend to lose faster the muscle mass. We're going to lose muscle mass with any kind of weight loss. So if you also see like people that they had bariatric surgery, if they don't consume enough protein, if they don't do like resistant exercises, they will lose muscle mass. The problem with the injections is that we tend to lose mass. Weight faster, and if we are not good with the intake of protein, because also remember these injections are going to suppress your appetite, so you are going to tend to not eat as much, and you get fuller faster. So like if you are not smart about the quality of your food, quality versus quantity, then it's very easy for you to like decrease your amount of protein, increase your muscle mass loss, and to prevent this, you have to increase your protein intake. Normally, it's like what 0.8 grams of protein per kilogram of weight. But whenever you're in this injections, they recommend to be at least double this. 1.5 or even 2 grams per kilogram of weight from like protein. So you can do that, and definitely don't forget about your resistant exercises. Aerobic exercise is great for your health in general, but resistant exercises are the best for maintaining your muscle mass, and also to help us to continue to burn calories and lose weight.
Dr. Gamboa, since I'm on the skinny injection, I've like completely lost my appetite.
Exactly.
So in the mornings, I've been using a muscle milk, a meal replacement.
Yeah, protein.
Am I
Yes.
hurting myself by doing that?
No, in your case, if you have diabetes also, Steve, then you have to be careful about those protein shakes, because there have been these protein shakes for these athletes, and they let's say these marathon runners, they're going to have a lot of carbs too, because they're going to use that as energy, but later on they need to replace that protein, So you have to be careful. Make sure that the ones that you have are very low carb, but high in protein. So there are a lot of shakes that are 30 grams of protein and very little carbs, like 5 grams of carbs. So those are the ones that you would like to do. Also, maybe like you can add some egg, like boiled eggs to your regimen. You want to do some, if you drink a lot of water, there's this clear protein powders that give you flavor to your water, but at the same time, they're giving you 20 grams of protein. So little things like that you can be doing to increase your protein intake, because as you mentioned, your appetite is decreased, and also like you get fuller faster. So make sure that you choose your foods wisely too.
Yeah, absolutely. This is from Jill. Jill is in Fort Worth. She said, I'm enjoying your show.
Thank you.
I can't believe there's a show out there that really targets real weight loss and not trying to sell a product.
Right. Thank you.
What causes weight regain after stopping GLP-1, and how do you help your clients maintain the results long term?
Thank you for asking that. That's an excellent question, especially whenever we hit our target weight, right? Or maybe because of cost, you're not able to continue with that. So what happens is that all of our bodies genetically are designed to gain weight. We are not genetically designed to lose weight. So every time you lose weight, no matter how you do this, either with surgery, with the GLP-1s, with keto diet, it doesn't matter. Whenever you lose weight, then your body is going to get into what we call the metabolic adaptation. And the metabolic adaptation is something that your body is trying to recover all what he lost. So in this phase, your hunger hormone is going to go up, your satiety is going to go down, whatever the GLP-1s were counteracting, and then your metabolic rate is going to slow down. So that's everything with the effort to regain the weight. And whenever your body is in this phase, there's no mental power, no like strength, nothing that is going to prevent you from the regain. So what I try to tell the patients and what we are seeing in the weight loss world is that there is like at least 7 or 10% of these patients we're going to try to reset their metabolic set point. What does this mean? Once you like hit your weight, we try to keep it there for at least like a year, because then in that way I'm trying to send the signals to your body to reset this metabolic set point and telling your body, hey, my weight is like now 150. I don't have to go back to the 200 that I used to be. So there are going to be like certain amount of patients that are going to be able to reset their metabolic set points. However, there are going to be some other patients, because of genetics, they're not going to be able to reset this. So we have to always like tell the patients it's possibly, obesity is a chronic disease similar to diabetes. So then we have to make sure that the patient understands this concept so that we are going to be in some kind of medication or controlling this for the rest of our lives. Because if we don't do that, then the weight is going to come back. Because if we say, oh yeah, we got her to the weight that I wanted, and then you don't do anything, no, like you're going to gain the weight and more, because your body is going to recover that with that metabolic adaptation. So we always have to be either like doing your exercise, eating healthy. And a lot of the times we have to be like periodically also with this like GLP-1s, like if not as, again, like as a chronic disease for the longest, but we cannot just cold turkey stop them. Because anytime you're going to stop it is the yo-yo diet effect. Same exactly, because of the metabolic adaptation.
Oh, here's a great question. This is from Jolana. She is in North Dallas. She said, ever since I found your show, I've been doing a lot of research thanks to you.
Great.
Can you talk? Hey, can you talk about the importance of metabolic flexibility, cortisol, thyroid, and gut health?
Well, thank you. A great question, because all that plays a huge role with everything. So like we're going to start with the cortisol part, we know that stress kills you, and it's because the stress increases your cortisol. And we see now, like if your cortisol is high, then what's going to happen? Your blood pressure is going to go up, your insulin resistance is going to go high. And then also like because we're having this like anxiety, then we feel cravings, because whenever you eat this comfort food, your brain and your body, like they make like dopamine. The dopamine is going to calm you down. So like we want into this vicious circle of stress, cortisol increasing, like eating to calm us down. So then we start gaining weight, so like, and that's a vicious circle. So then more weight, more insulin resistance. So everything goes like that. So that's why nowadays we try to check for cortisol levels as well. And we try to help you in natural ways with supplements, relaxation techniques, or like if you can find a hobby or something, that's one thing. We have to make sure that we have at least 8 hours of sleep. That is very difficult sometimes, because some patients, they have 2 jobs. So that is very difficult, and then again, we have to like meet where the patient is, but at least they have to have a quality sleep, because if you don't sleep well, guess what's going to go up? Your cortisol in the morning. Guess what's going to go up? Your insulin resistant, yes, but also your hunger hormone. So everything is a vicious circle. People that work night shifts, they have, I think, the worst time, because like now we're seeing so much links to cardiovascular disease and everything with changes in our circadian cycle. Also because the cortisol is messed up also there, because you don't sleep. You're sleeping whenever you're supposed to be up. You are like up whenever your body's designed to be sleeping. So it's very complicated. So hopefully at some point with the robots can do the night shift and the humans can do the day shift. And then we don't have to worry about that. And in that way, the circadian cycle is not messed up, and your blood pressure and the insulin resistance and obesity should get better. Thyroid is super important with all the metabolism and burning calories and everything, because the thyroid can get also messed up whenever you don't sleep well. whenever you have like this cortisol levels up, then that it can influence your like thyroid function. Autoimmune diseases like thyroiditis of Hashimoto's, that whenever you're having a lot of stress, a lot of like you're not eating well, you're eating like all this like the food that it's more like processed, and you don't have a good gut bacteria, you're more likely to like start having all these issues. Then you your thyroid doesn't work well, your metabolic rate goes down, you start gaining weight. You gain weight, your insulin resistance goes up. So everything is related with everything, and it's like all like it's intertwined together, you know, like, so we always have to look for your thyroid, your insulin resistance, your cortisol levels, and sleep, you know, everything it goes together. The same thing with people that they have obstructive sleep apnea. If it's not diagnosed, you don't sleep well, oxygen levels go down, then what's happened? You don't have a restful sleep. In the morning, hunger hormone goes up, cortisol levels go up. So everything, it's related.
Dr. Gamboa, you are so amazing. You know, we don't practice this at all. I know the questions Dr. Gamboa doesn't, but you can see she never has any problems with them. You know, first of all, is your hair look lighter?
Yes, it's a little lighter.
Looks wonderful.
Thanks.
Someone else.
I have to change some my
Yeah.
I have to change it a little bit.
Hey, we want to wish you a happy Thanksgiving, you and Harold both.
Thank you.
We're
You
just
guys
so
too.
blessed to have you
Thank you,
as part of
Steve.
the
Thank
show.
you.
You've touched so many lives. You'll be back again with us next month, and I can't thank you enough for being part of our show.
Of course. Thank you so much to you for inviting me, and thank you so much for everything. And you guys also have a blessed Thanksgiving, everyone.
You're the best, Dr. Gamboa.
Thank you.
We'll see you next month.
Thank you. Bye-bye.
That's Dr. Daniela Gamboa. She's amazing. I'm telling you, especially if you want to lose weight, she is absolutely so good at that. That's going to do it for us today. We'll be back again with you next week. I want everybody to have a happy and blessed Thanksgiving, especially our great producer, Rebel. She is the best. Hey, we'll see you all after Thanksgiving next week. Take care.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.